Good morning. Thank you very much. And you can exit right up here to your right.
Today is National Prescription Drug Take Back Day, and we're here today working in conjunction with the DEA and many local partners to get people to clean out their medicine cabinets. So many people begin their addictions with pain medicines from the medicine cabinet. So they start with that pain medicine, then it usually turns to heroin and other illegal drugs. So the addiction process really starts in the home.
I am so excited about what's happening here today. Drug Take Back Day means so much to all of us at Blue Cross. We've been supporting it for many years, really since it began, and it's just gotten bigger and better every year. So we're so excited about all the community partners.
The mission of Blue Cross is to improve the health and lives of Louisianians. So this is a big part of making people healthy and improving their lives. Most drug addictions start with drugs that are coming out of the home medicine cabinet. So the effort today is to get people to clean out those medicine cabinets so that those drugs don't end up in the wrong hands.
What we're finding, because of the addiction crisis we have in this country with 4 million people being addicted to prescription painkillers, we know that these prescriptions are being supplied through family and friends from the medicine cabinets. So if we can stop the supply at home from the medicine cabinets, and have people come and drop them off here and we'll destroy, we could hopefully potentially stop people getting addicted at a very early age.
It's a really big problem. It's a problem not only Baton Rouge statewide, nationwide. You can see with the heroin and opioid epidemic now, we're seeing it firsthand here. We always focus on our homicide rates in Baton Rouge, but it looks like this year probably overdose deaths from opioids, it probably will double the amount of murders. So it has become that significant of a problem. So we find that these people who are dying, they start with a pill. And then eventually when they cannot obtain that pill, and the pills that we are receiving here, they then go to street drugs and more harsher drugs, and eventually die, unfortunately. So it's a huge problem.
What are the penalties when someone is caught selling these prescription drugs illegally?
So, depending on is this your first time or second time being arrested or charged, the penalties can be significant, between 5 to 10 to 30 to 40 years. And, if you have many convictions, then you can even double those types of sentences. So sentences ranges vary, but they are significant. It is jail time.
Blue Cross implemented a opioid coverage policy January 1st of 2018. So our goal was to work with the community and try to get the opioid epidemic, doing our part in the opioid epidemic by trying to remove the drugs that were available to the community. So there's data out there showing that most people that are addicted to opioids get it from a friend's medicine cabinet or from leftover medication. So trying to limit the amount that prescribers are prescribing, so there's not that leftover medication in the medicine cabinet at home, which ties perfectly with Drug Take Back Day, which is another initiative that we have to try to do with the same goal, trying to get the drugs out of the medicine cabinets and into safe hands.
What kind of results have you seen?
So we have seen when we measure the quantity of drugs that are available to the community, we have seen an 18% decrease since January 1st of 2018.
I had a lot of old medication at my house. My husband is on several different prescription medications, and they've been changed over the last couple of years. And, you don't want to throw them away because you think you might need them, and then it's like, that's crazy. They're all expired anyway. So this is great. And I know we're not supposed to flush them or put them down the drain.
From illnesses in the family, you always end up with these extra drugs. So you don't want to put them down the drain. And so every time they have one, I try to see if I have something and bring it down.
What do you think of this Drug Take Back Day?
I think it's wonderful. It keeps a lot of drugs out of the hands that shouldn't be, and it keeps our water systems in that clear. So I think it's great.
I drove from Denham Springs to here to bring my father passed away March the 18th, and I brought all his prescriptions that we had laying around the house. So
Typically, what did you have here?
I really don't even know what all he had. Blood pressure medicine, all kind of stuff like that.
What's your feeling regarding this project?
Oh, I think it's great.
Well, my husband just passed, and I had about 30 bottles of medicine that I didn't need and wasn't going to do anything with, and I didn't want to give it away to anyone because I didn't know if it would be good for them. So when I heard about the drug program, I took all the labels off and brought it out.
I have a lot of prescription drugs from past surgeries, and I have been waiting to come out and drop these off to make sure it's safe to do that and not throw them away.
I saw an ad about dropping off the unused prescription drugs, and felt it was kind of crowding up in our kitchen cabinet, and those items that we didn't need, it's time to get rid of them.
What type of stuff did you bring?
Oh, geez, all prescription medicines, from allergy medicine to probably some of the, not necessarily opioids, but something like that the doctor prescribed for pain medication.
What do you think of this Drug Take Back Day?
Definitely something that is definitely worthwhile. Probably the second, third year we've done with it. I know the past times we've done it at the state trooper's office.
It's just a whole bunch of old medications and stuff that I had in my medicine cabinet. I've been hesitant to throw them down the sink or whatever, because I know that you can, spread different things in the water system. So I was afraid of that. So what I did was I just packed them up when I heard about it and brought them here.
Just to get rid of some old pills that I had around the house.
What kind of stuff did you have?
Just different prescription drugs and insulin and things like that are expired.
What do you think of this Drug Take Back Day?
I think it's great. Great.
We cleaned out my grandmother's cabinet and brought some all kind of stuff out here, just old, expired, unused, things that we didn't want in the house anymore and wanted to make sure they were disposed of safely.
What do you think of this Drug Take Back Day?
I think it's a great opportunity for people to get rid of drugs and get things out of their house that kids or others can get their hands on.
I saw it advertised in the paper, and I've had this stuff for probably 25 years, but it was always on the other side of town. So when I saw it here, I said, well, that's close enough.
What type of medicines did you bring out?
Prescription, all type of prescription medicines.
What do you think of this event?
I'm glad. Good thing to be doing.
My husband had cancer, so they were drugs having to deal with his cancer, some oxycodone, some morphine.
What do you think of this Drug Take Back Day?
I think it's wonderful, because otherwise, what are you going to do with them?
My partner is Canine Pablo. We've been together 10 months. His role at our office, he's an accelerant detection canine. He also tracks. He is trained in 14 different types of accelerants. So if there is a structure fire, any type of fire that is deemed to be suspicious, we will get called and we will run Pablo on the scene, and Pablo will let us know if there is a type of possible detection of an ignitable liquid. We brought one of our canines from the State Fire Marshal's office today to show our support for this incredible day that it's bringing all the departments together. It's great for our community. We have to do this as a joint effort. Narcotics on the street, whether they're prescription or not, can be very dangerous and is very dangerous, especially for the young children. They may not know what's in that prescription bottle, and it's in their mom or dad's cabinet, and they take it, and we could lose somebody. Studies have shown that drugs make the level of violence escalate, and whether we don't want that. If we could take that off the street, that's exactly what we're trying to do here. This is a safe environment to do it in. I see Zachary Fire Department, Acadian, Women's Hospital, Ochsner, Blue Cross Blue Shield, DEA, Baton Rouge City, PD, East Baton Rouge Parish Sheriff's Office. This is an outstanding turnout for such an incredible event.
As a pharmacist, I recommend talking to your doctor, talking to them about options, if there's other non-opioid options that may be available, different, physical therapy, exercise, and then also if you do get prescribed an opioid or any other pain medication, just making sure you get rid of it when you're finished with it and don't hang on to it, leaving it in the medicine cabinet for it to be used inappropriately.
It's similar to leaving a gun unattended at home. If you have children that come through your house, do you really know where the pills are? You know where your gun is? Is it secure? If you don't have any use for them anymore, let's bring them back here, get them out of harm's way, get them here where we can destroy them, and some young kid will not hopefully overdose, possibly die. And this is the way to do it. It's a good day today to come out and do it.
Message to the community is to, don't hang on to those extra drugs, get rid of them. We have safe drug drops all over the state that are available, and we also, talk to your provider or your doctor if you are nervous or scared or don't know about the pain medications and you want to know more about them. Ask about alternatives. There's other medications and different modes of pain relief that are out there that can also be used. So just have that conversation with your doctor.
Well, Women's Hospital is part of the Baton Rouge Health District. and we wanted to support the community effort to get unused drugs, and especially opioids, from people's homes. And as a pharmacist, we frequently get questions about what to do with unused drugs, and so we tell people about this twice-a-year event.
As a pharmacist, what are the most dangerous drugs that you want people to dispose of properly?
Well, really, any unused drug you should go ahead and discard of, but opioids in particular, because we have such a crisis with that going on right now.
What's your reaction to what we've seen here today as far as the turnout?
We're having a great turnout. It was just, I think we're going to collect a lot of unused drugs. There's a lot of other partners here that are promoting their different programs. One of the programs that we're promoting is our GRACE program, and it's to help pregnant women who are struggling with opioid addiction.
Healthy Blue Louisiana and our connection with Blue Cross Blue Shield, we have a partnership, and that partnership is key to us making sure that the opioid drugs are off the street. So we're doing our part, and we know one way to do that is partnering. And so that strength and partnership with Blue Cross Blue Shield is just another example of us coming together to make sure that we continue to do the things that's moving the community forward.
We're super excited. This is our second event that we've made it into a big community event. We officially haven't even opened yet, and we've already collected 5 full boxes of medications. So it's amazing. We're super excited.
What happens to the medications after they're collected?
All of the medications are properly destroyed by the Drug Enforcement Administration.
This has been such a great event. We're so happy about how everything worked out. We've had so many people come through here, great turnout, I think more than last year, which is our goal, and just so many people, I think, learning about the importance of Drug Take Back Day and disposing of their drugs safely. So it's just been a great day.
If people have questions like more information, what should they do?
They should check out Blue Cross's website. We have a special site. It's bcbsla.com/safe drug drop, and it talks about ways you can destroy your old drugs if you don't make it to Drug Take Back Day.